Okay, perfect, thank you. Hi everyone, so my name is Jabbour. I'm a PhD researcher at the Trinity Center for Global Health. And my PhD project as a whole is on developing a community mental health intervention for young people in Lebanon. But in order to do that, we wanted to identify the social determinants of youth mental health in Lebanon. So this presentation is just one part of the PhD project that I'm working on. Sorry, just a sec. So there are several landmark reports that exist on the evidence base that links social determinants to health outcomes, but few focus on mental health specifically. And this is important because we know that protracted chronic experiences of crises, whether these are settler colonialism, political violence, war and poverty, they don't just impact the individual, they impact the family and community functioning as well, because we know that the individual is embedded within the family and the community and the social systems. And this is important to take into consideration because up until very recently, interventions, whether these were practical clinical interventions or those developed through research projects, they haven't really been targeting the wider social systems, but this is changing this was changing over the past 3 years. So my main research question for this study was to identify the social, economic, and political structures that are meeting or not necessarily meeting the family's needs, whether we conceptualize the family as a collective unit in and of itself, or when we're looking at the individual members within the family. So to do this, we interviewed 19 families in August and September of 2023, which was last year. We partnered with 2 NGOs that provide HPSS services in Beirut and Tripoli, and these 2 cities are from the largest cities in Lebanon, so they're 2 urban, densely populated cities in Lebanon. And the first NGO in Beirut works with migrant domestic workers in Lebanon, and this NGO was developed through a participatory approach. So it's really migrant domestic workers and their families who were giving their input on what types of services they needed, what types of services should be delivered, and giving their feedback, and their own needs were prioritized in every step of the NGO. Whereas the second NGO in Tripoli, we partnered with an international NGO who primarily worked within child protection but offered MHPSS services as well, and we partnered with the local implementing partner as well. And while they delivered really good services, it was really a top-down approach that didn't really have a participatory approach, and this becomes important later when we talk about the results. So we interviewed 19 families that largely come from socially and economically disadvantaged communities. So besides Lebanese families, we talked to Syrian refugees, migrant worker families from Ethiopia, Sudan, and Sri Lanka. These families had to have at least one young person above 13 years old who accessed or recently accessed an MHPSS service. So we're not looking at a mental health diagnosis, but really the service use. The interviews followed a whole family approach and incorporated the drawing of eco-maps together. And what I mean by whole family approach is that the interviewer, I wasn't really trying to make a connection with the identified patient or the person or the young person in the family as opposed to the family as a whole. And we were using the eco-maps as a data elicitation tool. So to give you an idea of what the eco-maps are, if you think of the family genogram as explaining the different family connections and the different relationships between family members, eco-maps do the same thing, but for the community. So during the interview, the family was drawing with each other the different people, the different groups, the different institutions that were a part of the family, but not necessarily from the family itself. So they were drawing out a map of the community. And this gives us it's not just a way for the interview to kind of discuss how these things affect their mental health, but it also gives us an idea on the number, the strength, and the quality of the social relationships that the family has with outside structures. So we recorded the interviews and transcribed them, and we're currently, so the results I'm presenting today are currently tentative because we haven't finalized the thematic analysis yet. But just to give you a brief example, sorry everyone, I thought you could see my slides when I was talking. So this is these are two examples of the eco maps that we drew together during the interview. Yeah, can you hear me? Okay. Okay, thank you. So these are two examples of the eco maps that we drew together during the interview. The first one is with a Sudanese family in Lebanon. We have the two parents and the three children, and they were talking, during the discussion we were talking about the different people and social relationships and institutions around them. And I blocked out here the name of the NGO for the ethical reasons, for like the ethics application that we have, but you can see here that they have they have strong social relationships with the people around them. They are involved in lots of activities related to football and basketball. They are part of the Sudanese Cultural Center as well in Lebanon. So in Arabic under Sudan, you can see that they wrote Sudan Ramz al-Hadara, which stands for Sudan is the symbol for civilization. So the Cultural Center was really integral in developing their sense of pride in being a part of the Sudanese community in Lebanon. You can also, I don't know if it's very clear, but these are all different social relationships with groups, but besides the community center, Together Forever, they wrote Together Forever to express that they have lots of friends in the NGO. Besides this NGO, there are no institutional forms of support that the family is receiving. If we look at the second eco map, this was with a Syrian refugee family in Tripoli. And so the main person that the identified participant within that family was a 16-year-old Syrian refugee boy who is not in school, who works. So he drew those two structures, those two drawings, one at the bottom right and one at the top left. So this is where his father works, this is where he works. And there aren't a lot of hobbies or social relationships that exist within this eco map. So there's a man who's holding a gun, and this was supposed to reflect that there's a lot of gun violence and community violence where he lives. And then you have one of the main sources of support for that child was the fact that after work, he goes with his best friend to this, he called it a cave, where he goes there and he plays on his phone, he plays PUBG on his phone with his friends. And then you have, at the end, above the child's workplace, you have 2 cups of coffee. So this is something the mother drew to represent the fact that one of her main sources of support was to just have afternoon coffee with her neighbors. And so from these interviews and the eco maps, we realized that there was a very strong absence of government or public forms of support, especially following the 2019 economic crisis. So mental health governance was usually provided through the public sector, even if it was to a very limited extent. But because of the weakening of the public sector, because of the crisis, mental health governance shifted to a larger degree on NGOs. But NGOs, whether they were local or international, were not really situated to fill in the gap that the public sector left. So there was a lot of unmet needs within those populations. Social exclusion was also a very important thing that emerged, whether that was through bullying at school or in the neighborhood, racism or poverty. So migrant families, almost all the migrant families that we talked to couldn't access public spaces like pools because of racism. For Syrian refugees, having young boys at work and young girls out of school at home meant that they were largely excluded from socializing with their own peers. So this meant that their only form of interaction with other people was either through a phone or by hanging out with their siblings. School was described as a shattering and unbearable experience for almost everyone. So there was a unanimous description of public schools as a site of racism, bullying, and neglect. At most, they didn't really care about the school, but for most of them, it was a site of harm. So a few examples of how public schools were unbearable experiences for them. I can think of a few examples. So there was this Ethiopian teenager who was describing how she was the only one left out of birthday celebration invitations. Other Syrian refugees families were describing how the teachers themselves would bully the students, how they were a part of that bullying that existed within schools, how there was no structures in place for the parents themselves to kind of report on what's going on. This also meant that interpersonal support networks, because of the absence of institutional support, interpersonal support networks were kind of filling in the gap. So parents, primarily mothers, reported that they received material support from either family members or their neighbors to help pay rent. So in the previous example that I gave, the mother who would have coffee with her neighbors after every afternoon also said that they would loan her money so that she could pay rent. So there was a form of material and instrumental support there. If there's a family with a sick family member, the community would kind of fill in the gap so that they provide childcare when the family is off, when the mother is off with one of the children to take them to the doctor, for example. To link this to emotional experiences, the families expressed feeling insecure and uncertain about their life prospects, whether it's living under gun violence or community violence on a daily aspect, or whether they're uncertain about whether they can pay rent or have enough food on the table. These are all experiences that made them feel very insecure and uncertain. There was also an expression of feeling bored with the way life goes on, because it felt like every day was the same drudgery on and on. A few families expressed being resigned to their experiences with racism and poverty, so there was a sense of helplessness that this is the thing that they're facing. The only thing they can do is just tolerate it. So on the plus side, the coping mechanism they kind of showed was that they were patient with their situation, but on the other hand, this could also be interpreted as feeling helpless about their situation. There's also experiences of being ashamed and guilty of being the subject of like facing racism. So one example I can think of during the interviews, an Ethiopian mother was talking about how her child is ashamed of her picking him up from school, and this was a source of discussion within the interview about the type of internalizing the things that people hear within society. Finally, I think the study was able not just to identify some of the main social determinants that affect families, but also to link them to specific emotional experiences, regardless of people's mental health diagnosis. It was able to uncover the extent of unchilding taking place. So unchilding is a term that was really popularized by Nadira Shalhoub-Kevorkian. She's a Palestinian researcher who talks about childhood experiences living under Israeli settler colonialism. And this also applies in Lebanon, the concept of unchilding, because of the extreme poverty and racism and social exclusion taking place. Because of everything the families are facing, children are robbed of the opportunity to actually be children. So this process was also present through the families' discussion of their lives. Finally, I hope that this study builds the evidence base on the need for social and community mental health and psychosocial support interventions, not just in Lebanon, but in the region as a whole as well. Thank you.